Hi, I'm Dr. Deepak Shedde. I'm a practicing gynecologist for the last 20 plus years. Today we'll be looking at polycystic ovarian disease, the treatment aspects of it. I hope you have seen the previous episodes wherein which we have looked at the diagnosis as well as the causes of polycystic ovarian disease. If you were to see those, realize that polycystic ovarian disease stems from a simple problem of your cells, what is known as insulin resistance. This insulin resistance ultimately, through a cascade, causes an ovulation. So how do we combat polycystic ovarian disease? There are actually 4 ways to do this. One is tackle insulin resistance. If we were to figure out how to solve this insulin resistance which are in our cells, well, that's problem solved. But unfortunately, we don't have any medicines to change your genetic makeup. We have some medicines which help sensitize your cells to insulin a little bit, but not much more than that. The next thing we can do is to decrease your glucose. Because if you decrease your glucose levels, and when I mean glucose, it means glucose, fructose, sucrose, lactose, all the simple carbohydrates. So if you decrease your glucose, then your insulin level drops. And if you drop your insulin level, there goes your cascade. And with time, you'll be ovulating normally. The third option I have is to decrease your insulin levels directly. But it's not tackling your glucose levels. So the fourth method is to make you ovulate. But the problem with this method is it's not handling your hormone balances. So I get you to ovulate, but your hormonal balance in your body is not really very good. So you may ovulate, but you'll require either very high doses of the drug or the results are not really very good. I'm actually left with just one thing. And what is that? That is to decrease your carbohydrate load in your system. You need to stop eating simple carbohydrates. Stop eating carbohydrates, insulin level drops, and the whole cascade unravels. So what are the foods which contain simple carbohydrates? Well, they're basically 5 groups. So we have 5 things. So you have got your cereals, that includes all the rice, all the wheat, all the cereal groups. You have got the tubers, like the potatoes, the carrots, anything which grows under the ground. You also have the dairy products which contain lactose and maltose. You also have all the sugars, the sugar, jaggery, honey, sweeteners, the whole family, and all your fruits which contain primarily fructose. Now, all of these food products do contain a lot of other good things which we actually need. But in order for your PCOD to be handled, it's very important that you completely stop your simple carbohydrates, at least for a period of time. So your insulin level comes down. And once your insulin level comes down, then with time, maybe we'll start introducing some of these meals. But no, ultimately, at the beginning, you're going to have to do it the hard way. You'll have to stop eating all these 5 things, all your tasty foods, all your attractive foods, all the yum foods. But yeah, if you sacrifice these foods for a period of time, then your insulin levels are going to drop and the cascade will unravel and you'll start to ovulate. And all your skin problems and your weight problems and your fertility issues, all of these things are going to get better. Everything depends on what is your diet. Some girls lose a lot of weight, some girls don't lose any weight, some girls don't need to lose any weight. But if you follow your exercise and your diet together, you'll find that your results tend to be much faster. Now, please remember that this is just a health capsule and is for information. This is not a substitute for visiting your doctor. So before you go into any diet or you start doing any medicines, please check with your clinician who's actually managing you on site. So in our next capsule, we'll be looking at the treatment with medicines. Please put in your suggestions, comments, and please subscribe to this channel. Bye.